According to the Vice Dean of the University of Cape Coast School of Nursing, the pandemic has led to an astronomical increase in depression, anxiety, stress and trauma-related symptoms. This, he says, is having a toll on mental health delivery in the country. According to him, the crave for spaces and distances associated with COVID-19 has led to the suspension of some services that mental health care delivery would require. Dr. Narh Doku says apart from the trauma and stress-related symptoms, intimate partner violence, suicide, ideation and attempts, and child abuse have been noted to be on the increase in the country.
The quarantine and all the containment measures reduce the number of people with the disease by a significant percentage. The psychiatric and social impacts that are related to these containment responses includes an increase in depression, anxiety, and trauma-related symptoms. Intimate partner violence, suicide, ideation and attempts, and child abuse have all been noted to be on the increase. Other groups of patients impacted by COVID-19 include patients with substance use and those with alcohol use disorders. They may have increased risks because their services are being suspended. Pregnant patients with substance use disorders or psychiatric illness who may test positive for COVID-19 may require complicated and challenging care to optimize the prognosis for both the mother and the child.
He wants psychiatric nurses in the country to put in place careful monitoring and harm reduction strategies, as the situation could deteriorate if attention is not given to the psychiatric institutions.
But we all know the historic underfunding of mental health care in our country, the unemployment and uncertain government and private sector capacity for addressing the economic consequences that has come with COVID is leading to predictions of an incoming wave of unaddressed mental health care needs and increase in suicide rates. Psychiatric nurses must therefore put in place careful monitoring and harm reduction strategies.
Principal of the college, Dr. Simon Degidon, enumerated some of the challenges the school is grappling with and called for some support to deal with them.
Teaching and non-teaching staff accommodation is a challenge because most of the tutors stay in town and they commute from town to school and then back, which is a challenge. Limited space for computer laboratory, lack of transport for clinical supervision of students and outreach program for the registered community psychiatric nursing.
Head of Local Government Service, Nana Atuata, called for an increased effort in educating the masses on the adverse effect of COVID-19. Richard Kwejunya Akon, Joy News, Cape Coast.